So my purpose of this short video is to summarize a paper by D'Agostino et al. That was written in 2015 and published in the International Journal of Surgery about mechanotransduction and the biologic therapeutic healing process that is initiated by shockwave. So to do this, we need to have a firm concept of two important terms, firm definition of two important terms. First, shockwave. What is a shockwave? A shockwave is an acoustic wave. It is an acoustic wave that travels through medium. It is also a sound wave. However, a shock wave that is active within tissue is the pressure component of the acoustic wave. And this pressure wave does need a liquid medium to travel through and goes through our biologic tissue to initiate different events. What a shock wave must have by definition is a very high pressure wave that occurs quickly within nanoseconds. So we call this a very steep rise, followed by a low tensile or a low pressure wave. Both of these waves are going to occur within microseconds. So when we're hearing that shock wave click, that is those pressure waves being initiated, and they will travel through the biologic tissue that the shock wave is being applied to. Okay, so shock waves have high pressure wave followed by low pressure wave. They are a sound wave, but it is the pressure component that is active within our tissue. Now, the next term that is very important to understand is mechanotransduction. What does that mean? What is mechanotransduction? So by definition, mechanotransduction is taking mechanical energy and using it to create a biologic response. So one of the terms D'Agostino uses in this review paper is mechanobiology, because we are actually taking mechanical energy and producing a biologic response. How does this happen within tissue? The simplest way to envision it is that the pressure waves are pressing and releasing, or compressing and releasing to vibrate tissue. It's a very, very small amount of movement, not something that you see on in the tissue visually or even with a diagnostic ultrasound. However, it is enough that the extracellular matrix is moving and signaling, and the cell membrane is moved and signaling. So you're moving the tissue, it's giving signals through the extracellular matrix and cell membrane, and this causes a response within each individual cell. That response inside the cell is the mechanobiology. And that response has many different activities. It occurs through complicated but well-studied secondary messenger pathways. But mechanotransduction involves mechanical energy being transposed into a biologic response in our tissue. Okay, so we need to understand what a shock wave is. We need to understand the definition of mechanotransduction. Okay, so what is the result and the importance of this when treating veterinary patients? The importance is that it's a very tissue-specific event. There are different types of tissues that are mechanosensitive. A few of those mechanosensitive cells include tenocytes, osteoblasts, endothelial cells, fibroblasts, as well as stem cells. So all of these cells are responsive to the shockwave energy. Okay. They are going to basically result in different messenger pathways. So every cell type has its own messenger pathway depending on what the cell is doing and needs. So that is going to be different from cell type to cell type, but it's the results that we need to understand as veterinary therapy practitioners, okay? So the result within the cell is going to be events like angiogenesis and neovascularization, bringing the blood into the area, very important. We are also going to have things like interleukins and growth factors and other secondary molecules that are produced in each individual cell type. And these things can all be measured, and they have been measured, and D'Agostino gives a very good summary of what happens both in tenocytes, in tendon cells and tenocytes, and in bone cells. Both osteoblasts and osteoclasts are affected, but he gives a great brief summary. It's maybe a little too deep for this purpose, so I want to take that summary and advise and say, well, what do we see as practitioners? What is the result we are looking for in our veterinary patients? Simple, very simple. You know, it's angiogenesis, anti-inflammatory effects. Okay, so we're going to control the inflammation. We're also going to get regeneration of all of this of different cell types. This means we're regenerating tendons, we're regenerating bones. We're also stimulating stem cells, which is an important part of our immune system and our healing process. So that then was what was really well defined back in 2015. And I encourage you guys to take a look at this specific review. There are many great reviews on mechanotransduction. From here, we've learned a ton on the neurology side and how mechanotransduction affects the neuronal system. Now, D'Agostino does mention that back in 2015. Today, we know a whole lot more and super promising things. But for me, I just want to summarize directly from D'Agostino to help you envision what's going on. And the fact is that shockwave stimulation can positively influence the interplay chain of biologic reactions that through controlled inflammation lead to regeneration and reset local metabolism. That's a direct quote, but a pretty simple summary. We are basically resetting the tissue and stimulating natural biologic processes that were already involved in the cell. So I hope this helps you envision, understand a little bit about what's going on when you're actually putting that therapeutic shockwave on your veterinary patient. If you have more questions, please feel free to reach out to me. This is a very important topic for myself as a biochemist and as a small animal and equine advocate, and an advocate of shockwave therapy. So if you do have questions, feel free to reach out, and let's do good for our patients. But to do good for our patients, we need to understand what we're doing and take the time to practice best medicine. Thanks so much.